Okay, so if we're going to just say, and let me bring up my, nope, I don't have, there it is. Okay, so if we have, let's just say meiosis, right? Meiosis, we have, first off, in this case scenario, meiosis, I'm going to just start over here instead, okay? Just so it becomes a little bit easier when we're talking about it later. Meiosis, after meiosis 1, right? You have 2 cells, right? Correct? So far so good, right? And these cells, are they haploid or diploid after meiosis 1? They are haploid, yes. They are haploid. So I'm going to just put N. Okay, usually this is 2N, right? 2N meaning diploid, basically. Okay, so after meiosis 1, and then meiosis 2, you have total of 4 haploid cells, right? So what oogenesis is occurring, okay, they have this initial stem cell called the oogonium. Okay, the oogonium undergoes what process? Not meiosis, but mitosis. The mitosis will form, one cell is the, one cell is the primary oocyte, very good. This is the primary oocyte. And the other one is the, no. It's going to stay as an oogonium. So that it could undergo mitosis and form another oogonium and a primary oocyte, so that it continues, right? Because if it was a primary oocyte, then there would be no more oogoniums at the end, you know, kind of thing, to produce more primary oocytes. Does that make sense?
And then primary oocyte undergoes meiosis.
Yes, correct. So here we undergo meiosis 1. Okay, so if you want to think of this is still going in mitosis here for the oogonium, right? The oogonium forming, once again, what again? Another oogonium and a primary oocyte. Primary oocyte. Alex, you okay?
Yeah, I'm just trying to find it in the book, but
Oh, I don't know if they actually, I think they do mention it in the book. And let me find it for you later, okay? Okay, so here, the primary oocyte that you have here, this undergoes, what did we say? Meiosis 1, okay? But the primary oocyte, just to let you know, it halts, it stops at prophase 1. Okay, stops there until puberty. Okay. And even at puberty, not all the primary oocytes will start to undergo this process, okay? A lot of them still stay there. You just have a few of them that will finish meiosis 1 every month, basically. You have a few of them, okay? Not all of them, okay? Just a few of them will undergo meiosis, finish meiosis 1, okay? And every month you have a few more, every month another few more, so on and so forth, okay? So meiosis 1, you'll have what cells at the end here? Are they haploid or diploid, first of all? Haploid, just like what we have here, right? On this side here, haploid cells, okay? But these haploid cells, what do we say that they were? We have one that was a lot larger, right? Than the other, right? What was this one that's very small and will degenerate? Polar body. And this larger one is the secondary oocyte. This polar body, remember, it just gives off all the cytoplasm, all the cellular organelles and stuff like that to the secondary oocyte, so that the secondary oocyte will end up becoming the ovum later, so that you have a large cell to support the developing embryo. Does that make sense? Yeah. So you want most of the stuff in one cell. Okay. This polar body here potentially can undergo meiosis too, but it can also degenerate. But this secondary oocyte will undergo meiosis too. Okay, so there will become two other polar bodies here. Okay, this here actually stops. This secondary oocyte stops at metaphase 1. Okay, until when? Yes, until it is fertilized. Okay. So metaphase 2, sorry. Metaphase 2. Huh?
Since the brain isn't processing this anymore, is it possible for you to do a review of this, like, upstairs?
Yeah, I'm doing it right now, actually.
I mean, upstairs again, just to make sure.
Sorry?
Like, upstairs again.
Oh, you mean...
We have,
Okay, yeah, we could talk about it again. Yeah, that's fine. Okay, so this is undergoing now secondary oocyte. It will undergo meiosis, right? Meiosis what? 2. Forming a very large cell, right? And a very small cell here. The small cell is called a another polar body, secondary polar body. And this one is going to be called the ovum, right? We're done with the secondary oocyte. Now it's the ovum. And the ovum, when it's fertilized with the cell, right? With the sperm. Sperm plus ovum equals zygote. Okay.
All the processes before that, is that the menstrual cycle?
No, that's a whole different thing. Yeah, we haven't even talked about that yet. Yeah. Okay, so the reason why I want to bring this up is because when we're talking about follicular genesis, right? This is oogenesis, right? Follicular genesis. The very first follicle that we talked about, right, was a cell with squamous cells around it. What are those squamous cells around it? Granulosa cells, okay? What do you call this cell in the middle here? Which oocyte, though? This is the primary oocyte. Okay, so this primary oocyte that we've been talking about is at this point in time. Okay, most of them are going to be remaining at this point in time, meaning that a lot of them are going to be this primordial follicle here. Primordial follicle. Okay, it's not until puberty occurs and a few of these primordial follicles will now develop because of the FSH that we were been talking about in the past, right? The FSH, what is its name? Follicle stimulating hormone. So it stimulates the development of the follicle. Okay, so from primordial follicle, it becomes the cell with now cuboidal cells around it. What are these cuboidal cells called? Yeah, granulosa cells, right? What do you call this cell in the middle here? Still primary oocyte. We're still primary oocyte, okay? But what do you call this follicle? Primary follicle. Okay? As this primary follicle still has the follicle stimulating hormone of influencing it, it will continue to develop. But now when it develops, it now has multiple layers of these cells here. What do you call these cells around it? Granulosa cells still. What do you call the cell in the middle here? No, still primary. Still primary. Okay. This is now called a secondary follicle. Okay. Secondary follicle. The secondary follicle potentially could start to develop an antrum with it. Let me erase some of this stuff on the bottom here. Okay, so it could potentially look like what we just drew over there, or it could look like something like this, where we have a cell, some granulosa cells around here, and start to develop an antrum kind of thing. Okay, so here we have the antrum. Okay, around the granulosa cells, we have what cells around it? Theca cells now. Okay, so theca cells are now in play. Okay, what do you call this space in here? Antrum. Yeah, antrum. What do you call the cells or this glycoprotein around the oocyte here? Zona pellucida. And what do you call the granulosa cells around the zona pellucida? Cumulus oophorus. And the one directly around the oocyte is the corona radiata. Okay, so the cumulus oophorus has the corona radiata. Okay. Now the secondary follicle. One secondary follicle, there's a few of them, but one secondary follicle continues to develop into something a lot larger.
So secondary follicle has the corona, the cumulus oophorus.
Yeah, it's starting to begin to develop. But you don't see it until you have this what we have here. Okay. Something like that. Okay. Okay, so here now what kind of follicle do we have? The mature or pre-ovulatory follicle. What do you call this space again? Antrum. How about this cell here? Now we're at the secondary oocyte. This secondary oocyte that we've been talking about, now we're talking about this cell over here. Okay. Still has a zona pellucida around it, and around that we have the corona radiata, and then which is within the cumulus oophorus around that. And then you have the the theca cells, the theca interna and the theca externa around that. Okay. And at this point in time, ovulation will eventually occur with this secondary oocyte. Okay, so that's once it's ovulated, we have the secondary oocyte with the corona radiata around it. And this secondary oocyte will remain a secondary oocyte until when? Yeah, until a sperm starts to fertilize it. Okay, when the sperm fertilizes it, it will end up becoming a zygote. It'll just pass through during menstruation and stuff.
So, just to clarify, for the oogenesis versus the
Folliculogenesis,
Yeah. So those two can happen at the same time.
They are happening at the same time. But we're just talking about oogenesis is happening on only the cell that I'm like pointing to right now. Okay, it's only that middle cell that you see here. That is oogenesis occurring within follicular genesis. Okay, just that cell is occurring oogenesis. Okay. Does that make a little bit more comprehensible?
Put it on the book too.
Okay, you do see it? Okay, cool.
I was able to kind of follow it.
Okay. Alright, so let's go back into the uterus now. The uterus is where the implantation of the embryo occurs. It helps protect it and nourish it. It will end up forming the placenta and does produce certain hormones. The fundus is this anterior region of the uterus. It has a body, which is most of it, and it has a part that narrows it down. It's called the isthmus. The isthmus is where the cervix is going to be located at. Okay, so here is the my bad. Okay, so here the body, right? The body that narrows down is called the isthmus over here, and then we have a cervix, which is the bottom part here. The cervix contains an external os and an internal os. The external os is this one here that comes from the vagina to the cervix. The internal os is where the cervix becomes the isthmus, basically. Okay.
So the cervix is the isthmus?
No. So isthmus is part of the body still. It's just this part that narrows down at the body. Okay, so it was my mistake that I confused you. Okay, so the isthmus is just this part where it narrows down of the body. The cervix is below that, basically. Okay, more inferior to that. And then the cervical channel, the cervical channel or canal, it's the same thing. Is just this part between the internal os and external os. There is two spaces that you'll also need to know. There's the vesical uterine pouch. And this is a space between the uterus and urinary bladder. So this space right over here. Let me just, I guess, use a different color instead. This space right here is the vesical uterine pouch. And then there's the recto-uterine pouch. Is just the space between the rectum and the uterus. Those are the two spaces there. The uterus has different walls too. There's the perimetrium. Perimetrium is just the outer surface of the uterus. It's made up of serosa because it's continuous with the broad ligament and part of the peritoneum. The myometrium is the muscular layer here. Contains 3 layers of smooth muscles, and this is what contracts during childbirth and also during orgasm as well. The endometrium is this internal layer made up of simple columnar epithelium and lamina propria, and it has these glands called uterine glands. There's 2 layers of the endometrium that you'll need to know. One is the basal layer, which is just this part over here. The basal layer doesn't get shed during menstruation, while the functional layer, which is this top part, does get shed during menstruation. Like we mentioned earlier, the endometrium has these glands. These are the uterine glands. So this top part over here is called the endometrium. What's below the endometrium? The myometrium, the muscular layer. So if we take a histological slide of this here, we have the, what do you call this layer here? Endometrium. What do you call below that? So everything from here to here. Myometrium, and then the very outer surface here. Perimetrium, right? Part of the serosa, right? And what do you call these structures here? Yeah, the uterine glands. Oh, another thing I forgot to mention. So the endometrium, what do you call this specific layer here from here to here? Functional layer, yeah. The basal layer is the one on the bottom here.
So the basal layer also has uterine glands?
No. Yeah, the basal layer, you don't see that many uterine glands. So during the sexual cycle is about 28 days for the ovary. Okay, so the ovarian cycle consists of those phases, and the menstrual cycle consists of these phases here. And we'll go into each one. Okay. I guess we talk about the menstrual cycle first. Did we go into the fully? Let me see. Hold on a real second. No, we don't, actually. Interesting. Okay, well, don't worry about too much about the ovarian cycle. Although, if you think about it, the follicular phase, if you think about it, what's going to happen in the follicular phase? What's going to be developing? The follicles, right? So that makes sense, right? So when we were talking about like the primordial follicles being primary follicles, being secondary follicles, being the pre-ovulatory follicles, that's during the follicular phase. Ovulation, pretty obvious. We're going to have the secondary oocyte being ovulated from the pre-ovulatory follicles. It comes out, right? That's when ovulation occurs, and that occurs on day 14. Okay, right in the middle, basically. And then you have something called the luteal phase. The luteal phase is like the name implies. This is where the corpus luteum, whatever was remaining of the pre-ovulatory follicles, would become the corpus luteum, producing, once again, progesterone as its main hormone. Okay. So with the menstrual cycle, it begins on the menstrual phase. So day 1 of menses, meaning that once the starting of bleeding, this is day 1. Okay, it lasts about 5 days. Okay, after the first 5 days, then you have something called the proliferating phase, and this is from day 5 to 14. What happens on day 14 again? Ovulation. Okay, good. Okay, so from day 5 to 14, what's happening here is that, like the name is implying, it's going to proliferate the uterine glands, the functional layer that's going to be occurring here. So estrogen from the follicles. What produces the estrogen within the follicles again? What cells produces estrogen? The granulosa cells. The theca cells make the androgens, yeah, the androstenedione, and gives it to the granulosa cells to make estrogen. Okay, so the estrogen causes the follicles to increase mitosis of the stratum basalis, so that it becomes more of the stratum functionalis. So we're regrowing blood vessels in the uterus at this point in time. So here, notice how the very first 5 days are the menstruation is occurring here. Okay, and then the next almost 10 days, 8 days kind of thing, is the proliferating phase. So what's happening is that the functional layer of the endometrium is starting to grow. Okay, it's starting to grow. So this is what you have here in a histological slide. What is this layer on the bottom here? Yeah, you have some of the basal layer over here. Okay, and then a lot of this that you see here is part of the myometrium. Here's the functional layer, is probably this top part here, and here's the basal layer here. Okay, so let me redraw that. This division occurs like around here. Myometrium down here, endometrium up here, and the basal layer is starting to grow with the functional layer over here. Secretory phase, what's occurring is not mitosis. Mitosis is not occurring, but the accumulation of a lot of fluid to help causing more secretion. So the endometrial layers continue to thicken via the secretion of these fluids. At this point in time, the corpus luteum is secreting a lot of progesterone. And we talked about this earlier. The progesterone helps maintain the lining of the endometrium. And so what's going to happen is that the endometrial glands that we've been talking about are going to secrete something called glycogen. The glands become wider and longer and even more coiled. And that makes the endometrium very soft and wet, very nutritious for the embryo if it does get implanted here. And during this period of time, it's during this pretty much part here. Some people just included the rest of it. Okay. So here, notice how the uterine glands, how different they look compared to when we were looking at the proliferating phase. What's the difference over here? The uterine glands. Looking at this picture here versus this picture here, right? Yeah, it's a lot wider, right? It's a lot wider and filled up with a lot of these fluids and glycogen and stuff like that. Very good. What do you call this specific layer here? Yeah, this is the basal layer of the endometrium, and here, functional layer, right? This is all part of the endometrium here. Okay. The premenstrual phase is towards the end of this menstrual cycle, 26 to 28. And this is where you start to have some endometrial degeneration starting to occur because no implantation of the embryo. So corpus luteum becomes corpus albicans. So we don't have that much progesterone because corpus luteum, there's no more, right? So there's not going to be progesterone. So what happens is that the spiral arteries are going to contract. If you're going to contract these arteries, are you going to get nutrients to the functional layer of the endometrium? No, it's going to prevent nutrients to go there. So that's what's going to cause necrosis to occur. Necrosis, once again, is what? Tissue death. And that's what's going to be starting to cause these menstrual cramps. The endometrial glands and blood vessels will start to degenerate because there's not enough nutrients going to these areas. And that's going to start to cause blood to accumulate in the stratum functionalis. Okay, and this is going to start to cause the menstrual fluid to begin. So over here, the premenstrual phase over here is towards this end here. We don't have an actual slide for that. And then the menstrual stage, once again, it starts on day 1 of menses. Okay, so the menstrual fluid starts to occur, discharges into the vagina. It's about 40 milliliters of blood and 30 milliliters of serous fluid. So at this point in time, the stratum functionalis is lost. You lose it. So only leaves the stratum basalis now. So if you look at it here, here's this. What is this layer here? Yeah, myometrium. Myometrium. And what do you have left over here? The basal layer, the stratum basalis, right? The functional layer, all gone. Okay. Well, mostly gone. There's still a little bit left over here. Okay, so this is the menstrual phase. So be able to distinguish between the proliferating phase, secretory phase, and the menstrual phase. Okay, and pretty obvious, right? The proliferating phase, when we looked at it, right? The uterine glands tends to be small, functional layer not as big, kind of thing. When we look at the proliferating phase, the functional layer is pretty large. And what's happening with the uterine glands, they're also very big too, right? And then you look at the menstrual phase over here, what's happening to the functional layer? Yeah, it's shedding, right? There's not that much left, right? All you're left with is the stratum basalis over here. All right. The vagina is a copulatory organ for sexual intercourse, a birth canal for the baby to pass through, and also for menses to allow the menstruation to occur. As a child, it's a simple cuboidal epithelium, but as an adult, it becomes stratified squamous epithelium. And why would it be stratified squamous epithelium? For protection against, any kind of intercourse occurring in the vagina, right? The vagina also has these folds called rugae. And there's these spaces between the cervix and the vagina called the fornix. So this is a fornix. That space right there. The hymen is at the vaginal orifice. And it could be ruptured during intercourse using tampons, strenuous exercises, and medical exams. So you don't actually see the hymen on this picture. So it's not necessarily, it could be ruptured by these other processes, strenuous exercises, using tampons, so on and so forth. So it's not a clear-cut, determination of whether a person is a virgin or not type of. It's not able to be regrown. Okay, so the vagina looks like this here. Okay. So when we look at the vagina, we want to look at the mucosa layer. And when you look at the mucosa layer, specifically the epithelium, right? And when we looked at the epithelium, we noticed, we've seen it before. What was it again? Stratified squamous epithelium, right? Is it keratinized or non-keratinized? Non-keratinized, Stratified epithelium. Okay, for the external genitalia, it's called the vulva for the female. The mons pubis is this fatty layer on the anterior side. Okay, it's made up of skin and subcutaneous tissue. And that's where pubic hair will grow. On either side of the vagina here, it's called the labia majora. It contains sweat glands and sebaceous glands, and also pubic hair can also grow here. More medial to that, here's the labia majora here on this side. More medial to it, we have the labia minora. This doesn't have any hair and is made up of mostly areolar connective tissue. The vestibule is the space between the labia minora. Okay. So within the vestibule, we have the urethral orifice. Urethral orifice, once again, is the opening to the urethra. Vaginal orifice, which is posterior behind it. We have vestibular bulbs on either side that becomes erect during arousal. Okay, they're more of an internal structure, so you don't actually see it on the external view of it. The greater vestibular glands, once again, they secrete mucin to make mucus to lubricate the vagina during intercourse, and this is homologous to the bulbourethral glands in the male that we'll talk about tomorrow. And then you have a prepuce. The prepuce is a hood-like structure that covers the clitoris. And clitoris, once again, is erectile tissue, very similar to the homologous to a gland's penis. And it's made up of just the corpora cavernosa, which is erectile tissue. And then prepuce, once again, is that hood-like structures around it. So the most anterior opening is the urethral opening. You have the vaginal orifice behind that, and then you have the anus behind everything else.
So why do we need to
Hmm?
have two different structures?
Say that again?
We have both the vestibular bulbs as well as the clitoris, but why do we need two?
Oh, well, first of all, they are kind of they're erectile tissue for different things. One is just for sensitivity and stuff like that, and the other, I don't know exactly what's the function of the vestibular bulbs, but it does make it more. It causes, I guess, it's also for sensitivity purposes too. If you increase the amount of tissue at this location, it will put pressure on the nervous area, so it makes it a little bit more sensitive as well. And it does also make it changes different colors as well to show that okay, the person's ready for a sexual intercourse and stuff like that too. Mammary glands. These are the breasts that will secrete breast milk for children, for the infants. And it's used for defense purposes as well because breast milk actually has a lot of antibodies within it. When we look at the mammary glands, they have lobes. So each one of these large structures are lobes. The large structures, these lobes, contains these smaller structures called lobules. Okay. The lobules are made up of even smaller structures called the acini or alveoli. Okay, those are the ones that produces milk. And milk will then go through the lactiferous ducts here and drain out of the mammary gland into these larger lactiferous sinuses. Okay, so these are the lactiferous ducts going into these larger openings called the lactiferous sinuses. The areola is this darker pigmented area around the nipple, and it contains these areolar glands. The glands are there to, they're sebaceous glands to secrete, to allow, when, especially for a child when they're feeding on the mother's breast, it prevents them from cracking and chapping. Not to say it doesn't occur, but it helps prevent that from occurring. The nipple is erectile tissue, and it's, once again, to transport the milk. We have suspensory ligaments all over the place here to help support the breast and connecting it basically to the pectoralis major. We do have a model of the mammary glands, and probably you'll be able to see in the reproductive cabinet. It's not that detailed though, so you'll be able to just see parts of these. Okay, a lot of the breast is made up of adipose tissue. Yeah, most of it's going to be adipose tissue more so than the mammary glands themselves. Okay. So like female with larger breasts will have a lot more adipose tissue. Mm-hmm.
When people get older, right, they have like sagging.
Yes, and why?
Because of the ligament?
Yeah, the ligaments are getting worn out. Exactly. Okay, so we'll stop there, and we'll continue the male reproductive system tomorrow. Up to you guys if you want to stick around or not. But I think you guys most